Okay. I have my PPE on. My scene is safe. Mechanism of injury is a vehicle collision. Um, this is my only patient. I will be calling for ALS backup and considering C-spine. My general impression, I have a 25-year-old male who was in a vehicle collision. Excuse me, sir. My patient responds to painful stimuli. I'll be checking his airway. It is patent. Moving on to breathing. His respiratory rate is 26 breaths a minute, and I will be checking for lung sounds. He has decreased lung sounds, so I will be putting this patient on oxygen via non-rebreather mask, 15 liters a minute. Moving on to circulation, I will be checking his radial pulse. It is weak, but it is 128 a minute. And I see no major bleeding at this time. I will be making this a priority patient and get him on the road as quickly as possible. And since he is not alert, I cannot get a sample history at this time. I will be taking his vitals, which include blood pressure, respiratory rate, and pulse. His BP is 98/62. Respiratory rate is 26 and pulse is 128. Now I'll be doing the head to toe inspection. So I'm going to palpate his head. I don't see any liquid coming out of his ears. I check his pupils, they're good. I already checked his airway. Now moving down to the neck. I'll be checking the cervical spine, everything is good. I'll be looking for JVD, which he does not have, or tracheal. His trachea is good. Then I'll be moving down to his chest. Be palpating his chest. He seems to respond to that. And then moving down to the abdomen, I'll be palpating all 4 sections. They're all soft. Now his pelvis. It's good. I'll be glancing at the genitalia. And then I'll be moving on to lower extremities. Everything's good. Moving down and checking his pulse and his feet. And since he is unconscious, I can't ask him to move his feet for me. And then I'll be checking for the upper extremities as well. And they both have radial pulses. I do not see any secondary injuries, and I will be reassessing this patient's vitals every 5 minutes, which again includes blood pressure, respiratory rate, and pulse.